doctors, good evening. Welcome back to our classes. Dr. Swarna Balaji, online Ayurvedic classes. In today's topic, we are going to deal with fluid and electrolyte imbalance. This is the most important topic. Already most of you have requested to do this video regarding Shalyatantra and also Kayachikitsa purpose. This is not a thing which is limited to our examination purpose. This is a thing which you have to remember in your clinical point of view also. So that I have made this video how much I can provide you the complete details regarding the fluid and electrolyte imbalance in an easy way, so that I am providing you this lecture. Fluid and electrolyte imbalance. Before going to this topic, first of all, you have to know what is fluid. Is there any types in this fluids and what are the classification of this? Later on, how we have to maintain this fluid. Next thing regarding the electrolytes is, what are the electrolytes which is useful for our daily routine, and is there any abnormalities regarding this electrolytes, and what we consider them as, if suppose hyponatremia, hypernatremia, hypokalemia, hyperkalemia, what are the names, what are the appropriate terms given to that particular electrolyte imbalance. These all will be discussed in this session. So by this you will go thorough regarding this fluid and electrolyte imbalance. Firstly, fluid is of two types, intracellular fluid and extracellular fluid. Intracellular fluid consists of 2/3 of a human body. Okay, 2/3% of a human body will consider this intracellular fluid. Later on, extracellular fluid. This is 1/3 of the body. Whenever water intake is equal to water loss, the body is in fluid balance. Okay, whatever the person will intake the water, and that must be equal to the water loss, output of the water, then it will be considered as a fluid balance. Fluid balance will maintain the homeostasis. When both are unequal, the fluid intake and fluid output, water loss, if suppose there is an imbalance between these two, if suppose these two were unequal, at that time this imbalance will occur. It is considered as fluid imbalance. Normally, some of the fluid will loss through our body. We will see what are they. Normal fluid loss is 500 ml of fluid will be lost through skin. Okay, that is through sweat and all. 400 ml loss will be seen through lungs. 100 ml of fluid loss will be seen through stool, and urine output will be seen. Totally 1000 ml will be lost from a normal human body. And fluid input, what must be the fluid input? 300 ml of fluid must be intaken through our daily food. 700 ml plus urine output must obtain through drinking water. Whatever the urine output will be seen in a person, that must be intaken through the water. With the help of water, that must be covered. Then the fluid will be balanced in that particular person. Okay, is it clear? Normally fluid loss will be seen in each and every individual. 500 ml is through lungs, 500 ml is through skin, 400 ml is through lungs, 100 ml will be through stool, and finally urine output also seen in this. And the total will be 500 plus 400, 900, and the last one is 100 ml through stool and urine. No. So that totally 1000 ml will be the fluid loss in general. That must be covered through fluid input. How we have to cover? 300 ml must be intaken through the food, and 700 ml must be obtained through water intake. Okay. Next, abnormal fluid loss. In some conditions such as vomiting and fever conditions, abnormal fluid loss, most of the fluid will be lost rather than this normal fluid loss we said. That must be covered through IV fluids. So usually we will see in the case of vomitings and in fever conditions, IV fluids, that is saline, will be kept to the person, that particular person who is affected with that vomiting and fever. How, why we are giving that? To balance this fluid in that particular person. Next, is it clear? This is the complete introduction regarding the fluid and its types. Next, classification. What is the classification of these fluids? Number 1, crystalloids, colloids and special purpose sodium. This is one kind of classification. Okay. Next, maintenance of fluid, replacement of fluid, special purpose fluid. This is a second kinds of classification. Okay. Crystalloids. This is a one which is in general we will see ringer lactate, RL and normal saline. It is considered as crystalloids. Colloids means it is seen in the albumin. Special purpose solution is also a one which is 0.25%. Okay, this completes the normal classification of this fluid. Now, move on to electrolyte imbalance. First part, fluid is covered in our session. Now, moving to electrolyte imbalance. What are the normal electrolytes? We will see sodium, potassium, calcium. Okay, these were the in general normal things which we see in which we know in a human body. Sodium is, if it is present in a normal condition, it is considered as normal level of electrolyte. Here electrolyte balance is seen in that particular person. Okay, 135 to 145 milliequivalent per liter is the normal range of this sodium in a person. If it is less than this range, 135 to 145 milliequivalent per liter, if it reduces that range, it is considered as hyponatremia. If it is more than this, it is considered as hypernatremia. If sodium is less than 120 ml, milliequivalent per liter, less than 120 if seen in a particular person, at that time seizures will be noticed in that particular person. Okay, in the case of hyponatremia, hypovolemic shock will be seen in that particular patient. Treatment of this hyponatremia will be IV fluid administration, that is giving a normal saline. Okay, next, in the case of hypernatremia, if it exceeds its range, at that time you have to restrict the water intake and salt intake in that particular person, and the administration of DNS will be given in that particular person. Okay, and to maintain the normal balance, we have to concentrate the electrolyte balance in each and every individual. Okay, now treatment in the case of hypernatremia will be fluid intake and 5% of dextrose plus 0.45% of NaCl, that is sodium, must be administered to that particular person. Next, move on to potassium. Here, hypokalemia, hyperkalemia. These were the two things we will see in each and every individual. If the potassium normal range is 3.5 to 5.5 milliequivalent per liter. If it reduces less than 3.5 milliequivalent per liter, at that time it is considered as hypokalemia. If it exceeds 5.5 milliequivalent per liter, it is considered as hyperkalemia. The causes of this hypokalemia will be Cushing syndrome and any metabolic disorders. Administration of loop diuretics will cause this hypokalemia, and the clinical features which will be noticed in that particular person who is afflicted with this hypokalemia will be weakness and dyspnea. Okay, next, the treatment will be administration of normal saline potassium chloride has to be given to that particular person. Hyperkalemia, the causes will be any renal failure, and administration of any diuretics in that particular person will cause this hyperkalemia. The symptoms seen in the person afflicted with that hyperkalemia will be weakness and breathlessness. Okay, next, the treatment will be administration of oral. If seizures is noticed in a person, you have to stop that seizures. Okay. Now, this is the treatment for hypo and hypernatremia, hypo and hyperkalemia. Okay. And there were some things regarding the hypercalcemia and hypocalcemia. Means the calcium range, if it reduces the normal range, will be considered as hypocalcemia, and if it exceeds, considered as hypercalcemia. Okay, these were the things regarding this electrolyte balance. The most important things regarding the fluid and electrolyte imbalance were covered in this session. Firstly, you have to know fluid. What is fluid? What are the types of fluids present in a human body, and what are the causes? What is the normal range of fluid? How the fluid loss happens in an individual? How these fluid loss must be covered in each and every individual. Later on, what are the classifications of this fluid in a person? Next, electrolyte. What are the electrolytes which were useful in a human body, and what are the abnormalities? What are the normal range of these electrolytes were known by this session. How to normalize this fluid and electrolyte imbalance if it occurs in a human body were dealt in this session. So what you have to do is listen to this video twice or thrice and go to your examination. Cover all those topics which is said by me. Okay, you have to mention these headings and you have to define what is the thing said by me. Okay, so that you can present in a clear way in your examination. This will be helpful regarding the Shalyatantra and also in the Kayachikitsa paper. So what you have to do is, if this video is helpful to you, like this video, subscribe to our channel, share this video to your juniors and friends so that you will get more and more best quality of lectures from our side. Thank you. Subscribe and stay tuned to our channel for more and more updates.